Hi, I'm Paige, and I'm with UTMB's Nursing Informatics, and today I'm going to be interviewing two doctors from the Institute of Medicine.
Hello, Paige. I'm Dr. Jason.
And I'm Dr. Callie.
And we're with the Institute of Medicine.
So I was jogging, and I heard your show, and I have a question. I was wondering what the Institute of Medicine is. Can you tell me about that? Dr. Callie, do you want to take that question from our viewer?
The Institute of Medicine? The Institute of Medicine was established in 1970 to identify issues of medical care, research, and education.
It is run by Dr. Harvey Finberg, who is the president, along with other healthcare professionals.
We have another caller. Do you want to take this question, Dr. Callie?
Hey Paige, we heard about your show, and we wanted to ask you a question. We were reading this IOM report, and it was called The is Human, and we were wondering what that was.
Okay, that's a very good question. The is Human stated that by creating electronic hospital records, we improve delivery of healthcare in the U.S. Using EMR, EHR, and EPHR, we minimize the decentralized and fragmenting nature of healthcare delivery systems.
The report challenged us to make healthcare safe, and the EMR provides us with a way to do this with the use of real-time documentation and instant communication with all providers who are caring for this patient.
Thank you, Dr. Jason. We have another caller.
I'm down here scuba diving, and I hear about this report called Crossing the Quality Chasm. Can you tell me what it is? Oh, sure!
Crossing the Quality Chasm. It outlines the critical need for restructuring healthcare to improve patient outcomes. The report identifies 6 areas of focus. 6. Healthcare should be safe, effective, patient-centered, timely, efficient, and equitable.
It also provides a scenario of a working mother's plight with healthcare before, during, and after her diagnosis of breast cancer. Many of the problems she experienced could have been mitigated with the EHR, beginning with the failure of her past mammograms to be mailed, the failure of the physician to notify the patient of an abnormal finding on the previous mammogram, and the time spent locating her X-ray information in preparation for surgery. The scenario is not new to those of us who work in the paper world. We see it happening every single day.
Back to you, Paige.
Would you like to elaborate on that, Dr. Jason?
IOM published a report on the future of nursing with 4 goals. Number 1, nurses should practice to the full extent of their education and training. Number 2, nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression.
Number 3, nurses should be full partners
with physicians and other healthcare professionals in redesigning healthcare in the United States.
Number 4, effective workforce planning and policy making require better data collection and an improved information infrastructure. Back to you, Paige.
Thank you, Dr. Callie. We have another caller.
So can you describe the impact that these reports have on healthcare and the impact that it has on nursing care?
We have a special guest that's going to be joining us today.
So my name is Christina Myers. I'm a nurse with a bachelor's degree in nursing. I have a master's in healthcare administration. I've worked in med-surgical areas, in the emergency room, in the critical care areas, and served as a nursing administrator as well for numerous facilities, and work a lot with trauma patients and those type of patients. Computerized charting and electronics have had both positive and negative impacts in nursing. On the negative side, I think that nursing has been impacted, and it has columnized, kind of, I guess for lack of a better term. It has had employees put their ideas and select other people's ideas rather than coming up with their own, which is concerning for me in that there's only 10 answers, and if your patient doesn't fit into those 10 answers, sometimes you will adjust your patient to fit the answers that are allowed. That is concerning for me in electronic field of charting. However, I do also think that there are many positive aspects in that there are prompts to help nurses if they are a little more unfamiliar with certain specialities, such as with neurological patients and things that are not within the nurse's most comfort zone. And I think that with patients having access to their medical records and being able to transport those medical records more easily, I think that will overall help patients in the care that they receive when they seek health care at specialized institutions, depending upon what's wrong with them. So I think there are both positive and negative aspects to the electronic age as far as medicine goes.
Okay. Do you think it's improved communication between healthcare providers?
Absolutely. I absolutely think it's improved the communication between healthcare providers. When we relied on someone's script to communicate information, that information was sometimes illegible. Additionally, there were sometimes that abbreviations were used that meant different things to different people. And I think by going to electronic charting, it's helped with that information. Additionally, volume-wise, information can be condensed in electronic charting so that you can get information to a provider that otherwise you wouldn't be able to get all the information transported from one area to another.
Thank you, Christina. We have a few audience members that want to ask you a question. Yo, this is Mike. What changes have happened or will happen regarding this report? Dog.
In the future, I think eventually patients and physicians will be able to access a singular website that will eventually have a outlook of a patient from the time that they are born to the time that they are no longer with us. And I think that any medical provider that is given clearance by a patient would be able to access that information so that in a moment we would know what was wrong with the patient. If you were involved in a car accident and there's no one there to tell me what you're allergic to, I would be able to access this website with your information and be able to treat you appropriately rather than possibly endangering you through giving you some medication that was not appropriate and that you were maybe allergic to. So I think it'll help in the future.
Thank you, Christina.
A red wine, God, God.
Deep breath, 1, 2, 3.